ma'am. First of all, it is truly our pleasure to have you with us today to answer some of the questions on the occasion of Pet Cancer Awareness Month. To begin with, many pet owners tend to ignore small swellings or lumps. What would you suggest should be the very first step when an owner notices such changes in the pet?
Right. So first of all, thank you so much for having me. I think this is going to be great to give basic knowledge to a lot of our pet parents. So first of all, for small lumps or bumps, with any cancer or any actually mass, we need to know if it's cancerous or not, and that is the first step. And ignoring it is not going to make it go away. So we need a diagnosis. And how we get a diagnosis is basically by doing a few simple tests. The easiest is something called as a fine needle aspirate. It's a type of a biopsy. So what we do is we take really a very small needle, put it in the mass, and take that sample on the slide and take a look at it under the microscope. Most of the tumors can be diagnosed with this very simple test. It's like a small injection for your dog. It doesn't really hurt too much. So that is the first step that we need. Basically getting a diagnosis. That's also going to keep the pet parent's mind at rest. Once we know if it's not cancerous, we can ignore it. If it's cancerous, we treat it.
Secondly, when we hear the word cancer, most people immediately think of a visible growth or lump. However, are there any subtle or commonly overlooked signs of cancer in the pets, or say community dogs, that the owners should be more aware of in their day-to-day observation?
Yeah, absolutely. So one thing I think we need to understand about pets is they're champions at hiding clinical signs, right? Especially cats, where they will not really show pain. That's very easily identifiable. Some things to look out for, and this is true for any illness, not just cancer, is any subtle changes in behavior. So are they eating as usual? Are they as interactive? Do they want to play as usual? Have the energy levels dipped? Yes, obvious lumps or bumps you would want to take a look at. Some other things to look out for is there any bleeding from the urine, the stool, any oral cavity, nasal cavity? So these are a few things to look out for. And if you see these signs, take them to a vet and get basic examinations done. Because once we know what we're dealing with, it's only then that we can actually treat.
True. So as we all know, having worked in this specialty for many years now and with your extensive expertise, according to you, what are some of the most common misconceptions or myths that owners have regarding cancer in pets?
One of the most, I would say, commonly asked questions we have is, if we touch cancer, it's going to spread. So a lot of times pet parents don't want to do the basic diagnostics like doing a fine needle aspirate or a biopsy. And I understand where the concern comes from. If a biopsy or fine needle aspirate is appropriately done, it doesn't really cause spread of the cancer. I would say the chances of that is extremely low. But if we don't get a diagnosis, there's a high chance we're going to ignore a cancerous process, thereby, leaving it to spread to other parts of the body. So the number one would be touching the tumor makes it spread. Second, I would say very common misconception is cancer is a death sentence, which is again not true. Now with the advances, there are similar amount of treatments available in pets which are available in the human world. So we have chemotherapy, we have surgery, we have radiation therapy. There's a lot of research now with immunotherapy. So just because it's cancer doesn't mean that we don't have options. In fact, there are a lot of cancers that we can cure as well. So get an opinion and then decide what you would like to do next.
So often pet owners tend to delay veterinary consultation either due to fear or lack of awareness. In such cases, how significant is early diagnosis in improving the quality of life and prognosis of cancer in the pets?
That's a great question. And again, I understand the fear of knowing as well, because it means having to do these multiple things. But earlier you diagnose cancer, better is the prognosis. There's multiple prognostic factors we look at, which means what are some things that has shown to have a better survival rate. Smaller the tumor, in most cases, better is going to be the survival if we treat it soon enough. Also, longer the main cancer, primary tumor stays in the body, higher the chance that it's going to spread to some other parts as well. Hence, please get a diagnosis. The earlier, the better, and we actually might eliminate some treatment options if we wait for too long.
So nowadays, factors such as lifestyle, overall health management are increasingly being discussed in relation to cancer in pets. According to you, are there any lifestyle-related factors that may predispose pets to developing cancer?
Yeah, absolutely. Again, great question, because there's certainly some things that we can do, right? Now, cancer is a genetic disease, and there's sometimes, in spite of everything we do, we may not be able to prevent it. But there's certain factors or certain environmental factors that have known to cause higher chances of cancer. And secondhand smoking is a very common one. So if you have a pet, please don't smoke in front of them. It has shown to increase the chances of cancer. Obesity is the other one. Now, in our urban environment, our pets are not getting enough exercise. There's certain cancers that have been linked with obesity, just like people. Pesticides. So be careful about what type of pesticides we're using in our lawns and in our gardens, because certain types of pesticides have also shown to increase the chances of cancer. And one very preventable cancer is testicular tumors that are retained. So in dogs, there's something called as retained testicles, where the testicles don't descend into the scrotum, and there's a really high chance of these turning into a cancerous process. So this is a completely preventable cancer. If your dog has a retained testicle, don't wait to surgically remove it.
So many budding vets like us are always curious to understand the clinical approach. For them, could you briefly explain the general diagnostic process that is followed once a cancer is suspected in the pet?
All right. So now a pet comes to you with a suspicion of a lump or a bump or any of the clinical signs we discussed before. Whenever we're talking about cancer, we want to answer three main questions. First one being, what is it? And what is it is answered by doing simple tests like a fine needle aspirate or a biopsy or a tissue biopsy, right? So knowing what we are dealing with. The second thing is going to be how far it's spread, right? So where all is it? And that information we can get with certain staging tests. What that means is doing simple tests like chest x-rays, abdominal sonography, or we're using CT scans and MRIs more and more now. This is going to tell us if the tumor has spread from the primary location to some other parts like the abdomen or the lungs. Once we have that information, the next, information we need is how bad is it. So in terms of, say, a dog comes to you with a lump on the side, you've done a fine needle aspirate, it's diagnosed as a mast cell tumor. The next step, we've done a staging test, it's not spread anywhere. The next option, basically, the next step would be to discuss the treatment options, and surgery would be appropriate treatment option here. Once we surgically remove that, then we would want to do something called as grading of the tumor. There's certain tumors you can grade, and it's usually 1 to 3. If it is a high-grade tumor, we may want to consider adding some other treatment options just other than surgery. So what is it? Where all is it? And how bad is it? 3 questions you need to answer before giving the pet parents a prognosis or coming up with treatment options.
Okay. And lastly, on the occasion of Pet Cancer Awareness Month, what message would you like to share with our pet owners and vet students for watching this?
Yeah. First, I think the most important thing is we have options. Okay, and it's important to have a dialogue with your veterinarian. There are multiple different treatment options we have, And we understand cancer is scary. It is extremely scary for the pet parents. It's scary for the whole family. We understand the emotional burden that comes with it. But remember, there are different treatment options we can try based on how much financial capacity there is. But it needs to be a discussion. Also, in the veterinary world, our prime concern is a quality of life. So the fear of, okay, we are going to put our pet through suffering, we can alleviate that. We can do certain things to help their pets. Even if we are not treating the primary tumor, we can ensure that they can be comfortable. And that is our main goal with cancer treatment in the veterinary field. And as far as the last piece of advice, please get a diagnosis. If you find a lump or bump on your pets, get it tested. You will be at peace. And in case it's something bad like cancer, there are multiple options that we can, use. And early diagnosis, better is the prognosis.
So thank you so much, ma'am, for your time and valuable insights with us. We truly hope that this conversation helps spread awareness and encourages pet parents to seek timely veterinary advice whenever needed. Thank you so much.